Excellent. Okay, so Mark, welcome back.
Oh,
And I say welcome back because obviously the audio issues from the last time. Can't trust technology, especially in a lockdown. Um, the last time we did this, we started off by you introducing yourself. Would you like to do that again? I think because I think you can do it more justice than I can.
so hey guys, I'm Dr. Mark Tan, hair transplant doctor, and I help people with receding hairlines, and that's what I do. And I'm pleased to be here with Chris and First Man, our podcast.
Okay, so we mentioned on the last one that we were going to talk about the FUE. I think I'm saying that right, wasn't I? I said FUE last time. The
Yeah, FUE.
FUE hair transplants. If you could just go into detail about what they are, how they kind of work, and your specialist background in that area.
Mm. So yeah, FUE is a short form for follicular unit extraction with a new name of follicular unit excision. It's a form of harvesting in hair transplant. So it's not the only way, but it's one of the most common way, and it's commonly known as a minimally invasive technique in harvesting the hair from the back of the scalp, the donor area, and transplanting to the area in need. So for most of my patients who suffer from a receding hairline, looking to have the hairline restored, and it will be right at the hairline here. So that's FUE. Essentially, it's done under local anesthesia. So what it means is you stay fully awake. We harvest individual follicular unit, aka grafts or hair follicles or follicular unit, and then individually spread over a wide area in the donor, and that's the harvesting process. When it comes to the front, we make some recipient sites before we actually place the hair follicles.
And right now, the FUE treatment is by far the most popular. I'm seeing a lot of people doing it. I saw a fitness model called Mike Thurston. He kind of documented his journey. It was really interesting to see. Why do you think it's the most popular at the moment? Is it just simply the best?
Is it the best? It's an interesting one. I think the fact that it's minimally invasive and is one aspect of it is most common, and the second of it is the popularity of it because of the quick healing time, less noticeable scarring in the back, and that's helped with the popularity with men. So is it the best? Depending how you see it, it's difficult to say best because if you're good at FUE, then it's great. If you're good at other type of hair transplant surgery, such as strip or also known as FUT, both technique can actually yield really good results and in good hands. So depending if you're familiar with the FUT, then doing FUE doesn't make you better, obviously. And if you're good at FUE, then doing FUT again doesn't make you better. So I think do what's work for you, and each doctor has their own area of specialty, and if they're good at something, then maybe it's better for you to go see that particular doctor for particular technique.
Okay. I've
Mm.
been looking at the kind of prices for a long time now. I know that they started off like very high. It was only for, I believe, celebrities and rich people, and they've crashed down to around about, I'd say, average 2 to 3 thousand. Would that be fair to say?
Crash down to 2 to 3 thousand. You mean reduced by 2 to 3 thousand, or now is 2 to 3 thousand pounds?
No, it's around about that price. Is that fair to say, or is it a little bit higher still?
I think a little depending on the amount, because in the past the amount that we were doing was less, but the fee was higher. Now consider the same amount that we were doing, say 8, 10 years ago. We hardly do that amount now because we are more refined in our skills, and all the doctors are better, and we are doing much bigger cases compared to what we used to do. So the overall fee might went up, but actually the amount of work we do also went up as well. So for the same amount of work, I think it probably have gone down in fees. But as we further refine our hair transplant work, is we are actually treating with higher density. We are doing more transplant. So the case, like we talk about the amount of hair we transplant, we talk about the graft we transplant is actually way more compared to what it was 8, 10 years ago. So like for like, I think it's cheaper. It's gone down, but because we also get things more refined, we are aiming for higher density, better coverage, more work done in one procedure. So actually, the overall fee seems to have gone up a little, but or maintained in a similar level, should I say?
So something I found interesting last time that we spoke, sadly we didn't get that recording, or at least we didn't get your end of the recording, is the way that you spoke about how you might even turn people away if if they only have to get a small amount of hair replaced, and you'd rather them wait until it got a little bit more severe so that you could replace a lot of hair in one go to, I guess, limit the number of treatments required. Why was it that you did that again? What's the benefit?
So a lot of the time when patients first notice hair loss, so they might have, got a bit of receding hairline in there. They think, I saw it on the newspaper or the magazine, a hair transplant is a treatment. So not a lot of them, when they come to see me, I tell them, we can fix what is receded. A lot of the time, you need medications to maintain your own hair. So a lot of time, it was for very early receding. A lot, we put them on medications, and they might have some regrowth, and actually sometimes they might not need a transplant so early. So we turn away some patients, or let's not say turn away, we educate them to inform them what's a better option for them. So some of them go away and think, I can try some of these medications, and that seems to work, and so they might not need a transplant so early. And because there is only so much hair in the back and in the side, we call it donor reserve. And if possible, we can try to manage it carefully. So if we can delay the process a little, that's likely to help.
And you actually explained that last time, that the hair on the back of the head, sides sometimes, but the back of the head, that it's, I guess, it's a little bit more resistant to DHT than the hair on the top.
Indeed.
Is there any reason why, or?
Well, for male pattern hair loss, what we observe is that although genetically the hair follicles is same genetic if you analyze it, because we're same person, same gene, but the expression of how it reacts to the testosterone or the 5-HT is slightly different, and it's hypothesized that the hair on top is susceptible to male pattern hair loss because of the sensitivity to the 5-HT, whereas the donor area, if you're like me, who go to the coffee shop and look at people's walk past and he's got the good donor. The back and the side always have very thick hair, and they're resistant to male pattern hair loss. So that's the fundamental fundamental reason why hair transplant work, because the transplanted hair will behave like where it came from. So phenomena called donor dominance. So the donor characteristic remain the same even when it's transplanted from the back to the front. So that's why hair transplant is almost permanent. So it works for, once it's transplanted, the hair starts growing, it will be there for long term. So which can be a great thing, because the transplanted hair always going to be there. But at the same time, it can be a bad thing, because when you have transplanted hairline in the front and you lose more hair in the future, then it might create more issues.
Okay, yeah. The one question that a lot of guys have is the scar in the back of the head. So obviously you've got I don't know the real size of it, but most guys who get a hair transplant, they end up growing their hair back around about your length, maybe longer, because once you've not had it, you want more of it. It's kind of scarcity. A lot of guys I see go from being, let's say, bald, having a ponytail or a man bun within a couple of weeks or a couple of months, should I say. But for people like me who, even if I had a full head of hair, I'd probably like to keep my hair around about this length on the side, and then on the top maybe a grade 1 or 2 or something of that nature. Would the scar be visible for people like me on the back of the head because my hair would be so short?
So with follicular unit extraction, short form FUE, or known as follicular unit excision, the punch size can vary between, depending on the manufacturer, somewhere between 0.7 to 1 or maybe even 1.1 millimeters. So depending on the size, depending on the level of skill of the surgeon, depending on the preference, and also depending on what they want to achieve with the extraction. Sometimes they want to catch a little bit more multiple. Sometimes they're happy to catch a little bit less multiple hair. So depending on the size can also have different size of the scar as well. So the smaller it is, the less noticeable it is. And of course, when it comes to the entire donor area, when you spread it out, the extraction site, it will look less noticeable. So on a technical level, there's no such thing as no scar. So in fact, the ISHRS recommended we shouldn't use the word scarless or scar-free. So there's no such thing as no scar surgery. That's because that's how the body heals. But we can hide it quite reasonably well. For most people, if they have the hair in the back and the side like a grade 2, and that should keep the donor scarring quite unnoticeable. If you have a grade 2 or even longer, like myself, longer hair, then it's hardly noticeable in the where we took it.
Okay. One thing we touched on last time, which I was quite excited about because it's based around testosterone and how testosterone in men is dropping. We were discussing the average age of men that are coming to you and asking for hair transplants. Have you seen that that average age decline? Are there younger men coming towards your clinic, or was it the fact that there's more exposure around the subject? Which kind of route was it?
I think a bit of both. Some doctors like myself, because I specialize in fixing receding hairline. So most of the patients who come to see me is they want to have the hairline done because that's my area of specialty. And naturally, my patient is just a little bit younger compared to some of the general population. And it's not necessarily always the case because some practice have approach differently. But for me, generally, is the younger patients who look is the early stage of hair loss, been on medications, want to restore the hairline. So my practice generally have a younger group of patients. But actually, the latest ISHRS results on the statistic actually show most of the hair transplant worldwide, not just mine, worldwide, across all the members, actually, most of them are under 35 years of age, majority of the hair transplant surgery.
Wow.
So can it be because hair loss is a bit younger? I'm not sure about that, but I think we are more aware of it, and we are looking after ourselves a little bit more. Last time you were talking, could it be we were looking at more at the social media? We spend more time on the selfie and spend more time on taking nice photo, or it's like everyone has got a device in their pocket now. In fact, what I'm using now is a phone to do this. So inevitably, it's gonna have an effect on how we look and ourselves. So maybe we are in a selfie generation or era, so we are more self-conscious about it, or maybe just we have always experienced hair loss at around at this age, and I think also patients and are generally a little bit more educated nowadays. So because information is so readily available, we can Google things and Google will find us an answer. So I found that in the last 10 years or so through my career in hair transplant, patients are getting more and more educated. So a lot of the patients I see nowadays, they have already read through a lot of material, do a lot of research, and they're aware of what the treatment options available to them. And when they come to see me, they're fairly aware of what's work and what it doesn't.
Mm-hmm. And we're exposed to a lot of embarrassing photos now as well. You'll always see aerial shots of sportsmen, etc., where they've got certain spots missing, especially on the crown of your head. Especially there's, you know, a lot of bald patches here now. I don't know if that's always been a thing, but I feel like it's on the rise. I think this is the widow's peak, right? And then you've got the crown balding.
We've got the hairline in here,
Okay.
the temples, and then we have the hairline comes down to the temple points in here, and then they move in here in the frontal area, mid scalp, and then the crown area, and then the back, the donor area there. So which aerial shot do they usually focus on, Chris?
I think it's this one here. It's the aerial. It's the drone shot. It's the dreaded drone shot.
A drone shot.
Yeah. Or the short man shot.
So what's the drone view like for most men?
The what?
The drone view for most men.
What, completely above the head? The flyover. What I was going to ask is which ones? Why are they so different? Why is it some people recede here and some people recede here? What's the idea behind that? Why doesn't everybody recede in kind of the same pattern? Why is it some people? I've seen a lot of guys with a full head of hair from here, and then when they get to around about the crown, there's just a random bald patch. Like, how on earth does that happen?
Well, there is a different pattern of hair loss. Some patients have the hairline recede, so it goes back. And some patients have a variant that they may have recede, and then have a patch in some hair loss in the crown. Like you say, some patients have good hair right at the front and just hair loss in the crown. Not only that, some patients actually suffer from a diffuse hair loss, so they might have thinning all over, front, middle, back, but they never go totally bald, they just diffuse hair loss. So depending on the type of hair loss, that's just an observation of things. So it has to, is that a different genetic? It might be a little bit different in terms of the genetics, but overall it's still classified as male pattern hair loss. And treatment is not that significant different.
Okay, I've seen some studies which have said after people get, I saw it with Wayne Rooney, I saw it with Mike Thurston, that after they have their hair transplant, the doctors have advised them not to have sex, not to watch porn, not to masturbate. Is that because the DHT and testosterone goes through the roof? Bet you didn't see that one.
I think I saw this. I think I saw that comment. I think the other doctor did mention that. It was really funny. It was a post, and then they were a patient and asking about the is it safe? And then the doctor replied, "I think you're in safe hands."
Yeah.
But I think that's actually not very related, because the conversion of testosterone into 5-HT is regardless of the different activities, and as to does that actually affect hair loss, I think most evidence out there suggests it's not directly related to it. So what advice have we got for our podcast? Keep calm and carry on.
Did you just read that on the wall? That sounds like office material.
But yeah, I mean, for hair or post transplant, there's we say don't exercise heavily and don't do anything too strenuous. So you just need to take things easy. I mean, take things easy.
Yeah, because a lot of guys think that lifting heavy weights is going to lead to hair loss, but I mean, I think a lot of guys that have got giant muscles are on steroids. I think there's other things that have led to that conclusion. I don't think, doing a few compound lifts is going to lead to you being bald overnight. I mean, is there any evidence to that?
Yes and no, because a lot of time we look at the hair loss itself is first of all you have the genetic predisposition. Okay, so if you don't have the genetic predisposition, you can do you just won't experience hair loss. With the genetic predisposition, there are many environmental factors that can affect the process, so it can accelerate the hair loss. And sorry, I'm about to sneeze.
I've had hay fever today as well. Yeah.
Yeah, it's a high pollen count. So you have the genetic predisposition, and then there's a lifestyle factor. So if you were to, let's say, for example, use steroid or use testosterone injections, some patients do, and then it can potentially accelerate your hair loss. Same for anything. If you go on a crash diet or less than ideal diet, then it can potentially impact on the hair side of things. So it's same for major stress, major illness that can also cause acceleration of hair loss.
Okay. You said environmental things in order to accelerate it. Are there any environmental things you can do to reverse it or delay hair loss for longer? I know there's a lot of natural remedies out there, and are people wasting their time, or do they have some effect?
I think some of them experience some. I think we were talking about it the other day, and some patients may use some of them and find it helpful. Is that true?
Yeah, I've seen that DHT blockers, they've worked. I think it could be a placebo, who knows, but they've definitely worked on myself. Not all of the brands, some of them definitely didn't, some were better than others. I've definitely seen more hair shedding when I've lived a poor quality of lifestyle. For example, when I was younger and I'd go out drinking late nights, sleep on a sofa all night, and have a poor diet. And then I would wake up and my hair would be extremely, I guess, brittle. It would be very dry. And then as I got older and I lived a better lifestyle, I saw that there was a lot less hair fall. And I imagine I know it was from stress, it was telogen effluvium. But had I lived a better lifestyle from day one, I believe I would have retained it to this day. So it has helped me, yeah. But I do think it's inevitable. I think once you get to a certain point, I think you can delay hair loss as long as let's say is feasible with the products. But over time, I feel like the hair loss always wins. I don't know what it is, but it always wins over a longer period of time. You can delay it 5-10 years. It's always going to win. I can't explain it. I don't know whether it's hormonal or what.
Yeah, I mean the hair loss, because it's slow and progressive. So I wouldn't say it's always win, but because it's slow and progressive, it's constantly ticking in the background. So it's something that can progress with time. Of course, depending on your genetic predisposition. But if you are very active and in treating it, then a lot of time we still can win. And
the big fight.
And it is a long term fight against hair loss, because they're constantly affecting your hair in the background. So if you were not to be on the anti-hair loss medication, then sometimes they can, every time you come off medication, they can have an effect on the hair, and you lose a little hair without noticing it. And with time, so not to say they always win, because if we are very careful about it, live a good lifestyle, be very careful of that, and use anti-hair loss medication with or without hair transplant, then a lot of time we can maintain a good coverage.
Is there a time in somebody's life, maybe they're too old or they've lost so much hair that they're too far gone? Is there any period of time where that happens, or you know, is there a cut-off point where you'd say to patients, you're never going to get it back now, it's too late, or is it always reclaimable at any age or any, let's say, severity of hair loss?
Um, Depending on the expectations, we all hope to have a very good head of hair. But sometimes if you have very severe hair loss, so your hair loss affecting a big, wide area, then we might not be able to restore to very good coverage all over because a couple of reasons. Number one, there's limited resource in the back and the side, so you're unlikely to restore to the original coverage over a wide area. But you can still restore to a degree, and what I would suggest is ideally, if you can keep what you have without letting it progress to a big wide area, that's going to help because imagine that you starting to recede and you go on some anti-hair loss medication and that stabilizes it. And all we need to do is to restore what is lost, what is restore what's gone. And then that's a small area. And but I have experienced patients who just have too wide area and we can't restore it to a degree that they prefer. So it might not work. And in that case, it's better not to start the work.
So it's the wig at that point, is it?
Yeah, it can be done, or maybe changing the expectations. So a lot of time, when they come to see me and say, "Well, look, I really want to do something, some improvement." You know, a lot of times, some improvement is always possible, but does that reach what you had in mind? That's another thing. If that you can accept some improvement, if you have wide area hair loss, then hair transplant may still be for you, but a lot of time, most patients, when they think of hair transplant, is the transformation that they are looking. So sometimes it might not be always possible.
The results you want, yeah. Wig technology is getting pretty good as well. I want to do a documentary on it soon where I look at all the different hair cures, all the different solutions, and actually video, you know, the results before and after for each of these things. On the terms of alternative treatments, just for the future, where do you see things going? Is there a potential cure? And I'm really interested in stem cells and 3D printing. I want to see what's happening with them. Have you got any insight on them?
Well, I think stem cell is available now, and stem cell is available now, and there is used as a non-surgical treatment. And so I don't know if you have seen some of the new stem cell treatment. They take some of your hair follicles in your. They usually take it behind the ear, but I would recommend you can take it for the entire spread out from the donor area, and they use this stem cell and then to treat other parts of the scalp. And so far, from some of this presentation and studies, yielding good results. So things are hopeful, and things are moving quite fast actually.
Yeah.
And hair cloning will be upon us in no time. And so at the moment, I think the near future, the hair cloning.
That's the same thing, is it?
Slightly different. I think the hair cloning, what they try to do is take some of your hair follicles. So they take a few grafts from your donor, and then they send it to the laboratory and have that clone. And so you have a lot of hair follicle cells. So far, in the near future treatment, as far as I'm aware, usually this type of thing is top secret, but as far as I'm aware, these are used as non-surgical treatment. So these cells, when they come back from the cloning from the lab, they will use it as what I was describing earlier to inject over the scalp in an area that you experience some thinning. And these areas appear to respond to the treatment.
Excellent.
But I don't think there's any advances as far as I'm aware. They might be doing it. is to clone the entire follicular unit with the entire structure to be transplanted. So maybe this is in the further future. Maybe one day that hair transplant doctor will extract a few grafts and then send it to the lab. And you can come back in a few months' time. We'll have thousands and thousands and thousands
Spare
of
hairs.
Wow, great stuff, exciting stuff.
It is exciting stuff, especially for a lot of guys out there. So if any of my audience or anybody who's watching this for the first time wants to get in contact with you, maybe they want treatment, or maybe they just want to ask a few questions if they don't live, in the UK, where can they find you on socials and your email or anywhere else?
Yeah, sure. I'm based in Harley Street in London, and my website is www.drmarktam.co.uk. And I'm on Instagram too. Instagram is @drmarktam, Dr. Mark Tam, that's my name. And I'm also on Facebook, LinkedIn as well. You can call, you can visit us. And when you visit our website, you'll find that we offer a complimentary pre-assessment. So analyze your photos for your likely suitability first, and we'll provide a fee estimate and a preliminary design. And so you can have this information before you come and see me. So just to help you to make a decision yourself.
Excellent. Mark, thank you so much, honestly, for coming on the second time as well. I thought we'd lost all that information. Pleasure. And I know how many guys out there, especially young guys now, are struggling with hair loss, and they're trying to figure out maybe how to either grow the confidence and live with it, or probably the more likely solution, find somebody like yourself, get the answers they need, cost, treatment, etc. And you provided that for us twice now. And I thank you so much for coming on. And, I think it's worth noting, when I said to you, do you want to come on? Do you want me to, offer you some compensation? And you said, as long as my advice is helping people, that's okay, we've got you. As long as my advice is helping people, then that's payment enough. And I think that says a lot about you and your character, and I think people should get in contact with you, especially because I think you've got the right identity, you've got the right motive behind why you do your work. So thank you so much for that, and thank you from my audience.
Most welcome. Pleasure to be here, and I'll be happy to, if the information we talk about help someone out there, and it's well, there are a lot of people have their opinion over facts, and it's nice to know what my expertise can help someone out there.
Fantastic. Okay, I'll probably drop you an email afterwards. I'll send over all the files, etc. But thank you so much. Really appreciate your time, and I'll speak to you again soon. Have a great weekend.
Thanks, guys.
See ya. Goodbye.